All right, you ready?
Yeah, let's do it.
All right, guys, we are back live episode. I want to say this is going to be episode like 9 or 10. I don't know. I'm accumulating a bunch of these. I can't remember where we're at.
Just let them grow.
But James and I said, like, as soon as you get past episode 4, you don't have to do intros anymore.
Sounds about right. It's redundant.
I don't know if that's accurate or not, but whatever. Today, pretty cool because Brandon Wallpe is with us. Dr. Brandon Wallpe is with us today. For a lot of people here at our facility, our gym, I kept getting pestered about this. Like, when are you going to have Brandon on to talk?
Oh, gosh.
Yeah, well, I mean,
it's a good thing and a bad thing at the same time, right?
It's a good thing. I mean, people obviously know that you have some well understood, you have expertise that is needed for everybody to hear. And so today, you know, if you're watching on YouTube here, there's no computers, there's no notes. Like, Brandon and I are just going to organically go about this because
empty,
yeah, absolutely
no
empty.
Post-its either. So
we're going to talk about, you know, whatever essentially comes up. But long story short, and I'll let you kind of introduce yourself. There's going to be plenty of people listening to this that have no idea who the heck you are. But Brandon is our in-house chiropractor that we really appreciate working with because I think. I know we share very, very, very similar values, and it's very hard to find that in the medical field. Okay, it is. It's hard to do. It's hard to navigate. So, without going, before we go too far in depth, go ahead. You give me a little bit of background. What you do, where you're from, all that fun jazz.
Cool. So, as Colton said, Dr. Brandon Wallpe. I grew up around here in Southeast Indiana, graduated from Batesville in 2009 and went off to Ball State and studied exercise physiology and actually started as a basically a microbiology major for pre-med and then moved to pre-PT and then ultimately just moved over to exercise physiology because it aligned more with what my thought process was in my track and career field.
Gotcha.
So I was not even involved in any way, shape, or form in chiropractic or even was in the radar of going to chiropractic school when I graduated early from Ball State in my undergraduate. Within 3 years, I finished, decided that I wanted to do physical therapy instead. So applied physical therapy schools, literally had an interview at Emory College. It's down in Georgia. And I was going to be going down there like the week after I visited Logan in St. Louis, where I went to chiropractic school. Canceled that interview. As soon as I went to Logan, I was like, you know what? This is where I probably should be. They reached out to me. I'm going to give this a go and see what it's like. So my journey in health was not necessarily perfect. From my growing up years, from adolescent on, even through college, I lived a horrible lifestyle. I'll be honest. I didn't eat well. I didn't exercise as frequently as I should have, and I did exercise. I was an athlete. I was involved in sports. I loved to be active.
I don't know anybody that had a perfect upbringing.
Oh, yeah.
Myself included.
It was
not great.
It was not abnormal for my brother and I to probably, after like football practice or after a baseball practice, come home and probably eat a box of Cheez-Its and go through like 2 gallons of milk in a week. Actually, that was probably maybe like 3 days. I don't drink milk anymore, by the way. Like, I haven't had a probably glass of milk in 3 years. Man. No necessity.
No, it just I think we'd be fooling ourselves if we tried to put on this facade that we were the epitome of health, and
right?
Learning about all this stuff. Like, that's not true. You meet anybody who's trying to give you information that tells you that's what their life was. I would write that one off really quick.
And that's the big key is there was a transformation that occurred. So like from undergraduate, not even wanting to be in chiropractic, to going into chiropractic school as a blank slate.
Sure.
Knowing a little bit from shadowing, from having chiropractic care on a musculoskeletal basis level, like simply just because I had some lower back pain from football and baseball.
Right.
Like in football, I had a neck injury my freshman year. I had a lower back injury my sophomore year, which ultimately was a ruptured disc. Like, I physically could not walk for 3-4 days.
Been there.
But those history events led to me going to chiropractic school. Ultimately, it was like God's intention for me in life was to go there.
That's awesome.
So
and that's cool. And I've actually never heard you like explain it just like that, but it rings kind of true for me as well, because when I went to school, I had a lot of different options, in my small school that I went to, but one of their best, this type of area training or schooling was their kinesiology program. Yeah. And it was one of the best programs around that was going to fulfill everything you needed in order to get into, graduate school. It looked excellent on applications if you graduated from Hanover College with a kinesiology and integrative physiology degree. But in my mind, I didn't want to go to grad school. I don't know. I didn't know what I wanted to do, but I knew I could find a way to still help people. I knew I wanted to help people. There was an educational time frame where I was like, I wanted to be an educator of some sort, which I guess technically I am. But like I thought about, elementary ed, stuff like that. I enjoy kids, working with kids, but it wasn't until I started having, in my collegiate career and really after high school as well. Like I was seeing a chiropractor in high school twice a week because I had such bad issues. It wasn't until after all those added up that I was like, maybe there's a little bit of a calling to go here and navigate, some of these waters to help maybe prevent some of the stuff that we deal with or we dealt with, right?
Yep. Oh, yeah.
So it's kind of interesting because, back pain is one of those things that everybody wants to know about.
Oh, yeah.
And I know that we could go into one heck of a rant on this, but there's so many different reasons, variables, and you can't fix it all with an ibuprofen.
No, you can't. And even you can't fix it all with just an adjustment too. Sure. I will be honest, like the adjustment is a fantastic way of a therapeutic treatment to impact the neuromuscular physiology. But some cases of low back pain are simply because people continue to put lighter fluid on the fire based on what they're eating and doing on a lifestyle basis.
Sure. So perfect segue into this. Why, in your mind, if we as a facility here, and I'm talking about Reclaim, we do a lot of coaching on. Obviously, we love to train. We work out. We do all this fun stuff. But optimal health is like one of the biggest things that we're after. Oh yeah. Teaching people how to get to optimal health. How come you and I we mesh so well with our conceptual understanding about getting to optimal health? How does chiropractic care fit into that?
So a lot of the mesh comes into play because we understand the foundation of where health comes from. That ultimately you begin there. And you look at how many different categories are involved. Right. You don't just have overall physical health that could be impacting how somebody is functioning and how their physiology is working. You have to look also into the internal structure of the body. You have to look into the digestive-based function. You have to look into every single systemic level. And then on top of that, throw in emotional health. Oh, yeah. Throw in mental health. Throw in all aspects that create what a person is. Sure. Because every single human being is unique and different. And that's the thing at Reclaim, like you guys do an awesome job because you focus on the person. Right. And how they can best achieve whatever health goal they have. Some of them, they may not want perfect physiology. Sure. A lot of people try to attain it. Very few achieve it. Yeah. But you at least give the opportunity for them to be able to do it. Absolutely. I think that's a, when you think of the at least at surface value, you're talking about health and fitness or whatnot, you tend to think or you reach towards aesthetics or something like that, right? But, that's essentially what we're trying to do, cutting against the grain. Like, I always tell people that, until your physiology is in check, aesthetics aren't going to follow it. The physical will always follow the physiological. And so and I think, even people in their initial preconception about, what chiropractic care is just like, this is muscle, spine, healing, so that way I can go continue to beat myself up or just carry out my daily lives, right? That's pretty much, yeah, unfortunately. I'm not going to lie. Like, initially, my lack of understanding about chiropractic care led me to have that belief as well. Yeah. But then it was just like,
conversations, you know, obviously between you and I, like I've been on your table many a times, and then my family's on your table, and you know, my kids, my infant kids are on your table.
Yeah.
Like I physically see and can connect dots and understand how their physiological well-being changes.
Oh yeah. Yeah.
You know, I mean, it's very profound. Like it's something that highly interests me. And I think most people just look at it as a cure for back pain.
Oh yeah. The sad thing is, and I'll be completely transparent here too. Even within our own profession, there are practitioners who only focus on pain.
I'm sure.
And that's it.
It's everywhere though. It doesn't matter what profession you have. There's going to be the good and the bad for sure. That's why we felt fortunate, you know, obviously that you happen to be, you know, literally down the road from us, and you know, now have an office in our facility, and you know, it's very, very beneficial because like, hey, we can provide other health opportunities, not back pain management opportunities, but I can provide health opportunities for you via, you know, your services and whatnot. So I like that. Obviously, I love the understanding that we have a very good mesh when it comes to our firm ground and understanding of physiologically and where overall, you know, holistic health comes from. If you want to use the word holistic.
Totally. You have to.
Whole systems, right? So, you know, a lot of the things that, you know, we experience in our facility, it all originate. Well, I guess they all kind of surround back pain, right? So that's how chiropractic care comes up usually, right? Something hurts. What should I do? Well, you should go see a chiropractor. Okay, in your mind, okay, I don't want to say is somebody wrong to think that, but how should they go about pain management? You know what I mean? Like, this is such a broad question.
Oh yeah, totally.
But you know, I think about it at the top of my head. You know, everybody's like, well, I need to talk to Brandon. I needed to go see what he says about it. And in the back of my mind, I'm thinking, okay, there's a major difference between, you know, chronic and acute injury, trauma, however you want to look at it. You know, going and getting laser treatment or going and getting adjusted or whatnot. Like, just like you alluded to at the beginning, like, it's not going to fix anything if we're putting gasoline on the fire of what's truly happening. So I guess in your mind, if somebody has pain, back pain or other, like, you know, where should we start to first self-identify before we're like, hey, I need to either seek counsel or seek help or whatever. Or maybe you need to do that first anyways. Like, just give me your thoughts on it.
So a lot of the times, like, if I'll be honest, patients come in for pain, they stay because of everything else. They continue care because of everything else, because they're realizing the benefit of their care for overall physiology. But so I'll have new patients that come in for the particular reason of really musculoskeletal pain, whether it be to trauma, be it via injury, whether it be due to some sort of pre-existing condition that has alluded to more pain. Maybe it's a referral pain pattern. But the biggest thing is, like, for any new patient, when they come in, I sit down with them for a solid 30, 40 minutes and we talk.
Right.
Simply just to figure out what could be triggers based upon what it is they're filling out on our thorough history examination forms to see what is going on in our initial intakes. And I'll start breaking these things down and looking at, okay, well, what happened 10 years ago when you had this specific type of injury? What was going on with it, and how did you end up recovering from it in the process? And if we see some compensatory changes, that might be the reason as to why they have specific pain in a certain area.
Sure. So, like, just a layman's term in that. So, like, somebody had a car wreck.
Yeah.
So, use an example. Let's say they had right leg pain or whatever. The compensation would go to the left side.
Possibly. They could have a left ankle, left knee, something.
Like that. Yeah. So at least we're identifying that, you know, that compensation method. That's why, like, having a history, you know, even from injury standpoint, can become so beneficial for you. Otherwise, you're just chasing your own tail trying to figure out, well, why is this person hurting so bad?
Oh, exactly. And we also have to take into account possible degenerative changes too as we age. Somebody's moving in a biomechanics standpoint in a poor level. We have essentially the way that the body adapts. So the acronym is GAS, so General Adaptation Syndrome. It's fantastic stuff.
Fantastic. We've talked about that a little bit.
Yeah, and it's true though. I mean, your human body is made for adaptation, and sometimes it will adapt improperly, unfortunately, and that's why, like, arthritic change that occurs. Think of somebody that's moving improperly. internally it's creating friction, it's creating inflammation, it's creating a problem within a joint space that's restricted. When we look at back pain, neck pain, it very possibly could be within a joint of the spine.
Right.
And when that's the case, the body's natural response is to, hey, maybe we should try to protect this. If somebody doesn't go get active care to restore proper motion, which is where the adjustment comes into play, we restore appropriate motion to reduce inflammation to a specific joint segment. If that's not given back to the body will adapt.
It will adapt. And I can come up with a lot of examples for that. You know what I mean? I think that, I've always believed that your body's smarter than you are, and it always will be.
Yeah, no doubt. And that's where we align very well.
And that's where we get into trouble at times, is because that we can't take a step back and consciously self-examine the fact that, hey, I'm moving very poorly.
Yeah.
And it's not just because, the old thing, the stigma is that, hey, as you age, you're just going to cripple over and hunch and you're going to walk with a limp. It's like, no. That's not supposed to happen.
Yeah, it's one of the most depressing things I hear in the office.
I literally watched a video the other day from a local health administration, somebody in their PT talking about hip replacements and how to manage arthritic issues in their hip. Mm-hmm. And they're talking about how to properly use a cane. And they're talking about how to properly go about scheduling your cortisone shot and how anti-inflammatories won't work. Or how if anti-inflammatories don't work, now we look at the hip replacement. Mm-hmm. And I'm sitting here just scratching my head like, is there ever a thought that maybe this person's hips are so jacked up because they are wearing shoes that have 2-inch marshmallows on the bottom of them, mm-hmm. and they lack ankle stability, which causes knee instability, which causes excess stress on the hip? Like, mm-hmm. do we ever think about going back that far to help treat?
Unfortunately, in major medical approaches, no. Like most of the time, and even some of the things that we're taught in school too. Yeah, we were taught in chiropractic school where I went to at Logan in Chesterfield, Missouri. I have a younger cousin who's there right now, actually, Evan. So hopefully he'll be making his way back to be the second Dr. Wallpe in the area. Nice. We'll see.
Get him on the podcast.
Yeah, he's a big dude though. You're going to need a higher space. He's about 6'8", so.
Holy crap. Yeah. He's a little bit bigger than James. I give James a bunch of crap because I got to widen the camera lens so he can fit in it.
Yeah, it'd be a little challenging with Big Ev, but yeah. But where we went to school though, and where he's at and where I went to, we're taught, and most chiropractic programs are this way, where you're taught, look for the root cause. Figure out why it is that something is developing. And if there's enough anatomic change that hinders your ability to help someone heal, try to make the best of what you got. But at the same time, you can be limited. There's such thing as max medical improvement.
Sure.
And that's in the case for any kind of a conditional problem. But like in this case, when we look at the example for the hip, what always is pushed directly right off the bat is you go to your medical doctor, they give you pain meds, say, well, you got some pain, we'll prescribe you some PT, you'll go do some exercises, some of which may or may not work depending on how good your physical therapist is. Fortunately, there's a lot of really decent ones around this area. I will be honest. Yeah, there are a lot that do a great job, and we have a great relationship with a lot of the different PT departments in the local area. Just because we refer patients back and forth, we co-manage patients to help them get back to a functional independence. Most of the time, though, some people do not progress appropriately. And a lot of it has nothing to do with what is found on an X-ray.
Sure.
Most of it has everything to do with what they are doing lifestyle-wise.
Well, and you said, like most people, you go in with an issue, they take an X-ray. What's the one thing that they usually can deduce from an X-ray?
They'll rule out fracture.
Correct.
Get rid of red flags, always first and foremost. Sure. But arthritic change.
Well, you can notice inflammation via X-ray, yes or no?
Slightly.
A little bit? Okay.
You can see some soft tissue swelling, but gold standard's MRI. In all reality, if you could possibly get an MRI to every single patient that comes in.
Oh, yeah, that'd be great.
It'd be perfect. The downside is, though, unless everybody's got a $2,000 check just sitting waiting to be paid. So,
so when you get, something, looked at, some kind of scan of some sort, mm-hmm. Whatever you can afford, mm-hmm. Usually, and this is my experience, because I've had tons of MRIs and scans done, and I don't, draw, much correlation until I actually look back and kind of assess everything that happened with me. But like when there's a scan and they're not looking and they're not seeing the thing that they thought they would see, it's usually, well, you just have some inflammation in the area.
Oh yeah.
Right?
Yeah.
That's the catch-all for everything.
It's scapegoat.
It's inflammation in the area, okay?
Yep.
Or, anything along the lines of that. And so usually that prompts the anti-inflammatory meds or the cortisone injection, there's stuff like that. And so most people are sitting here thinking, okay, I'll do this, but then what?
Yeah.
Instead of sitting there, being the patient, listening to, whoever medical professional is telling me, like, hey, you got inflammation in your area, instead of saying, hey, doc, why do I have inflammation in the area? Or, matter of fact, why doesn't the doc turn around and say, why do you have inflammation in the area? You know what I mean? There's not enough screening to really say, hey, this person's activity lifestyle is horrible. Very sedentary. They don't do weight-bearing exercises to improve joint structure. They don't obviously, they don't eat well. You know what I mean? They're just re-inoculating themselves with inflammation based on their dietary choices, right? Yeah. And so I've always stood by my stance, and I have no, I'm not the doctor in the room. I have no clinical research to support it, but I don't think cortisone injections do anything for anybody as far as healing goes.
Oh gosh, no. They don't heal a thing.
I've never seen somebody with a cortisone injection return 2 weeks later and say, I'm good as new, and not have a problem later.
Yeah. No, and ultimately, I'm glad you bring that up too. So with cortisone, interestingly enough, like it doesn't help any healing effect at all in any way, shape, or form. It reduces inflammation at the moment.
So that your body has a chance to heal itself, right?
Exactly,
okay.
Correct. Okay. The problem is those overutilization of cortisone injection. This is shown through the literature. Like you can look on PubMed, you can look on all research platforms and studies that have been done in utilization of specific steroidal-based anti-inflammatories being injected into joint spaces. It wears away the tissue. It actually increases the degradation process.
Oh, that's good.
Of the joint.
That's good.
So people who get, an injection, they put them on a regimen and say, you know what, you need to, that's why now they're doing more, I'm really loving this, is that even locally more orthopedic physicians are spacing out these injections to give people time to make a correction, to make that lifestyle change, to maybe not necessitate another injection. But before, it used to be, well, let's do an injection here, and if you're not feeling better in a week, we'll do another one right around it, and if you're not feeling better, we'll do another one again.
Well, how does that look like for the patient, though? Your interaction with that professional, hey, we would usually do a cortisone injection every 6 to 8 weeks, but let's do 12 weeks.
Yeah.
Are they just left with that? It's like, oh, I'm going to wait longer? Or is there a push to be like, hey, there's something causing this. We need to figure out, like you said, what's the root cause? What's the why? Why is it happening?
Yeah.
At least from the conversations that I have with people, because I send people to get checked out all the time. If it's out of my wheelhouse, it's out of my wheelhouse. Yeah. And I'm not going to wear a hat that I'm not able to wear, but I send them with questions.
Oh, yeah.
I said, ask them these things. And they don't, and I say they very loosely just because there's only a few people that have really, done this, but like, they don't know the answers to it.
Oh, yeah, exactly.
So there's a gap, as far as whether they're allowed to ask these questions or they just don't, or I guess I don't know, but there's a disconnect somewhere between your patient and health care professional relationship.
It's true. Yeah.
And I don't know, it's hard because when people come back to me and they're like, hey, doc says I'm out 4 to 6 weeks, and I said,
why?
Give me the reason, like give me everything that you're doing and everything. And like, well, they just told me to take these and rest. And I was like,
that's not an opening experience.
So then my follow-up question is, then what? I said, are you expecting to be healed by then? And they're like, well, I don't know. I said, that should have prompted another question between you and your healthcare professional.
Yep. Oh, yeah. Well, and the problem is they're focused so much on the subjective pain. That's the issue.
Everybody just needs the pain to be gone.
Yeah.
I totally get that.
Yeah.
Totally get that. And we did
Well, even the physicians, too. I kid you not, yesterday I had somebody who came in. There was a little bit of a trauma. They fell and injured their knee. They go see their physician. There's other issues that are also present that are involved in this, which would mitigate healing response. But they just threw him in a brace. They just said, hey, brace it and wear it for 6 weeks. Did not even say follow-up, didn't even say anything. Didn't even say they were going to re-examine the knee, didn't even do anything. And didn't even tell him what was wrong with him. Didn't even tell him anything whatsoever. And I'm sitting there like, what have we become if we are not even able to, as physicians, to discuss with a patient what actually is happening from an injury and how to appropriately take care of it? Because just slapping a brace on something and saying, all right, you'll be good in 6 weeks is not good enough.
There's a weird little paradigm shift now. It seems like it's gone from health care to health prescription.
Oh yeah,
You know
no,
what I mean?
it's about running through a wheelhouse, unfortunately. Yeah.
And I know people deal with that, and don't get me wrong, there are plenty of awesome doctors and healthcare professionals out there. Like, I'm not going to loop everybody into one ball here.
Yeah.
But
that's why I refer patients to those physicians.
Oh, sure. Yeah. And we have the people that we love, based on how they handle things. It's just, I think as a whole, there's a long way to go.
Yeah, it's true.
And there's a long way to go for everybody in something. Like, I get that. It's not going to be perfect tomorrow, but these are real issues that we deal with people.
Yeah.
How do you manage your pain? Well, it's easy to go get checked out by an orthopedic specialist and get an MRI and then get a cortisone shot, and then 6 weeks later, we're right back where we were, except you're $4,000 in the hole.
Yep, exactly.
You know what I mean?
Which always baffles me in the process there, because a lot of people's excuse to not see a chiropractor is they think it's expensive. I don't think anyone ever in my office within a matter of a year will ever spend $4,000.
No.
If they do spend that much in my office on care that's provided in the office, that I am physically one-on-one contact and helping them, if they get to that point, it means they're coming to see me like 2 times a week, which means I'm not doing my job correctly, and I have to adapt.
For sure.
Like, that's what always baffles me in the process. But and you're right, we've come to it's a weird scenario when it comes to healthcare, because we've been ingrained since we were younger. Like, for your and I generation, like, we're looking at individuals who taught us, if you have a problem, go to your doctor. Always go to your doctor and trust every single thing your doctor says. That shouldn't always be the case. Like you said, in every profession, there are really good individuals who are dedicated to the growth and advancement and being able to help people. And then there are some that are just showing up to show up.
Sure.
And that's where we're trying to have that discernment on, is this the right physician for me? Do they actually have my health care and best interest?
Sure.
And if it's somebody that says, hey, you know what, I want to, like, unfortunately in my field, it's challenging because there's a lot of really good physicians that just kind of take advantage of the scenario that we're in, where they can just say, hey, I want you to come in 3 times a week for the next 4 months. Well, let's be honest, people have jobs, one. People have kids, 2.
People are short on 2 things.
Cash and time. Yeah, exactly.
For sure.
Time is the most precious commodity, and so thing we just don't have enough of.
For sure.
But in that process, though, if they're coming in 3 times a week, are you really helping them? Because I can get the same exact results, and Dr. Meyer, who's the associate in my office, he does a great job as well. We don't see people more than twice in a week unless they have an acute flare-up that necessitates, one, either the examination, we deem that there's too much hypermobility or too much damage to perform an adjustment, to where we just do some sort of a soft tissue therapy or a laser therapy modality, or we perform acupuncture in the process because it's less aggressive in the process there.
Takes less for the body to heal, right?
Exactly. And then we'll adjust them later in the week. So with a lot of what we do with our patients, though, is not have that continual revolving door where they're in, out, in, out, in, out. We'll sit with them, talk with them, figure out what's going on, so that way we don't have to see them 3 times in a week.
Sure.
So
and that in my mind, it's great. And at least I think I would look at it that way. Like, I don't want to see you again, but if I have to, make sure you come back and see me, type thing.
Exactly.
I know you like me, but not that much. You shouldn't be coming here and just dropping cash every.
I'd rather you spend time with your family and drop your cash on them, or to support other businesses as well.
Enjoy your functionality, your health, and all stuff. I think a lot of people, we're at odds with a lot of our own situations. There are plenty of people that get, insurance can only cover this doctor. Mm-hmm. Insurance can only do this or that, and you're limited to your selection. Don't get me wrong, some of the best doctors in the world are the ones that are the most hard to get scheduled with.
There's a reason for that.
There's a reason for that.
Yeah.
And so I think at least if you have an understanding of the questions to ask and not just following along with the protocol, you can weed out your doctors.
Oh yeah.
You can weed out the good from the bad.
Oh yeah.
And it just comes with a little bit of education on your side and a little bit of understanding, like I said, questions to ask and connecting the dots as to why.
Yeah.
Okay, doc, why do I have inflammation here? I don't understand this. Why am I having compensation issues? I don't understand that.
Yeah.
There's nothing wrong with asking a question.
Oh, yeah.
Like, there's so many people that are embarrassed to ask questions as if they don't know. This is not your profession, more than likely.
Yeah.
There's a reason you need to ask questions.
Yep.
You know what I mean? I love it when people ask questions. Matter of fact, I love it when people ask questions that I don't know the answer to.
Exactly, because then you can figure it out.
And then I just added another tool to my toolbox.
Yeah,
you know
exactly.
What I mean? And that can just be a mindset thing, you know what I mean? Just be okay with the fact that you don't know everything yet, and you are working to that point.
Exactly.
Especially when you're talking about pain management.
Oh, yeah, and even in general, just talking to a physician, which if we look back, like, doctor was teacher. So that's essentially, you look at this, it's synonymous. There should be some sort of an education process every time you visit your physician, every time you visit your doctor. And if you don't ask questions, you don't learn anything new. Because a lot of the times, physicians will tell a patient what they might already know, because there's readily available information now. Granted, I don't agree with Dr. Google. I don't agree that people should make self-diagnoses. That's a very dangerous thing to do.
WebMD, man.
Yeah, man.
Done wonders for
in a weird way.
Yeah.
But if you go into a consultation even, or just a history, just to speak with a physician, whether it be your medical doctor or whether it be an osteopathic physician, some sort of subspecialty physician, or even just coming in to see myself or a colleague like mine as a chiropractor, you have to have specific questions in mind. And like, some of the biggest ones are always the ones that are forgotten about.
Sure.
So like, that's where I'll always tell a patient, like, hey, if you have any questions at any point in time through this, ask me. If I don't know the answer, I'll find it.
Right.
And if I don't find it, I will let you know. And it's a very simple and transparent way that really physicians need to be with their patients to be able to help them achieve that functional independence.
Right.
Because what most patients don't realize, most general public, most everybody, and this is every human being, they don't realize the fact that the greatest healer is their internal body itself.
Yeah.
By perfect design.
No, it's what your body is meant to do.
Exactly.
It is meant to heal.
Yeah.
Like, no person in a white coat, I don't care what area of health they're in, is going to heal you better than you are going to heal you.
Exactly.
Ever.
Some of them have been given wonderful gifts to be able to help you
Put
in
you
that
in a
journey.
position to heal.
Exactly.
Yes.
Yeah.
Absolutely. Yeah.
Yeah.
100% agree on that. There are, and obviously you're in the chiropractic realm. Okay. We're not talking physical therapy. We're not talking osteotherapy. We're talking essentially just practitioners as a whole. I think that there could be improvement everywhere.
Oh yeah.
And there's plenty of improvement I can make at just teaching people how to be healthier. Don't get me wrong. I try to stay on the preventative side of things. You know what I mean? But the approach, that relationship between patient and practitioner, I think, is something that we can help educate the patient more.
Yes.
Before they go in. And we're obviously relaying this, and we're kind of getting very broad, but like we're talking, about injury or pain management. You know what I mean? And you deal a lot with pain management.
Yeah.
So let's just go down this one for a little bit. You have somebody, let's paint a hypothetical scenario. At work, okay, let's say they have a fairly taxing job. Somehow or another, they get the very common, shooting pain down their butt cheek, down the hamstring, forcing them to literally walk awkwardly so they can keep pain, weight off of it. How do you go about managing that situation? Okay. And I guarantee you there's probably like 80% of the people out there that can probably,
relate to that.
Relate to this.
Yeah.
You know what I mean?
Considering the fact that like 80% of I'm trying to remember the statistic. There was a study on workforce labor that they stated that the most common reason for missed work is low back pain.
Right.
And the most taxing type of, on a financial standpoint, as far as medical bills are concerned, for some people it's due to lower back pain on a repetitive basis, for that matter. So you have somebody that comes in working a desk job. One, why?
Right.
Like, I don't know about you, but I have to move.
As we're sitting here talking in our podcast.
To be fair, this is probably the most I'm going to sit all day long.
It's okay. It's only an hour long.
Yeah. and it's one of those where we're made to move. We're made for that functional movement. And if we don't have that, we will start to have issues. And specifically when you have individuals who, when they work all day, they're sitting at a computer, one, you throw in low back issues, you can throw in neck pain, headache, but that's another time for another story. But when we look at just the sheer biomechanics of what develops just from them with static sitting, one, you get anterior pelvic tilt because of the tightening of the hip flexor iliopsoas muscles within the front of the pelvis. You end up getting a increased pressure through the lumbar spine. So interestingly enough, when you stand, that is not the most pressure that is developed through the intervertebral discs. It's when you're sitting.
Right.
So right there, you are already putting yourself into a compromised position for the rest of your day if you sit for at least 2-3 hours, for that matter, at a time.
Sure.
They come in with pain, I'll talk to them. Be like, hey, what do you do every day? How long are you sitting? Do you commute to work as well while you're sitting an hour in your car? On top of the 9, some people now 10, 11 hours that they're working in front of a desk.
For sure.
So right there, you're looking at literally out of their waking hour through the day. So most people on average, probably they don't sleep as much as they should, which is needed for recovery. Let's be honest.
Did that podcast a couple episodes ago.
I listened to that one. It was good. But like, if you're not getting the appropriate rest that's needed, one. So you look at your waking day, there's 24 hours in a day. Again, we all have the same amount of time in each day. We all do. There's no difference in that. My watch might be fast because I keep it that way so I don't run late with patients.
But you're still getting 24 hours.
Exactly. So I'll get in, I slept 8 hours. I went to bed at 9:30. I woke up at 5:30 this morning. Went and worked out at 6. So that way I could make sure I had that time. Got in a very good programmed regimen that you made this morning.
There
very
you
good.
Go. Throw that plug in there real quick.
Oh yeah, but
send you a check later.
Right. Getting to the office though, I sit there and fortunately today I haven't really had any that are too sedentary as far as individuals, but I know that this week I have a handful. But it's because of the nature of their work, they're forced to stay in that seated position, and they all have the same issue.
Right.
It's lower back pain due to what's called like an anterior pelvic shift. So it's a lower cross syndrome where we have complete weakness developing in the glutes, complete weakness in the core, and an overactivation of the hip flexor muscles in the lumbar erector spine.
I wish we could, everybody would watch the YouTube video on this, because we could get out this little pelvis here and we could really show you exactly what that works or that is. But lower cross syndrome is essentially what I dealt with all through high school because of the way that we trained for football. And this is very, very, very common in high school athletics.
Yeah. You want to know the other reason too?
No.
Think of K through 12. What are we doing all the time? You're sitting.
Right.
All day long. That's all kids do.
Yeah.
Like, especially since they're cutting PE and recess programs and extracurriculars, like, what are people thinking? Like, we're going to create probably the most sedentary, lethargic, lower back pain ridden generation for here to come unless we make some sort of a change. Yeah.
So the lower cross syndrome thing, so if you think of I'll try to do this visually since we're on like radio here. So if you took the front bones of your pelvis and you pulled them down, okay, the back side of your pelvis raises up, okay? So that kind of gives you the pregnant lady look, kind of belly out, butt up in the air type thing.
Well, we know how comfortable that is for them.
Over-exaggerated lumbar spine, okay? You get that when you sit down. And so while you're sitting down, your hip flexors are essentially constantly under tension. You go to stand up and you try to stretch those back out, and your body essentially stays in that position, but now you have a compensatory, that pressure on the facets of your lumbar spine. Okay, so that accurate? Okay, so like the lumbar spine itself is sitting there taking additional stress being in that position while you are seated. You know what I mean? Yep. And so this leads to my favorite thing to tell people, because I help. You and I kind of collaborated on a lower back rehabilitation program. It's worked wonders for people.
It has, yeah.
And honestly, the biggest thing that I had to tell people, when you have any kind of acute issues or you have, just back pain, whether, it's led on for a couple of days, kind of in a chronic state, but if you do get back pain, the worst possible thing you could do,
Keep sitting.
keep sitting down.
It's the worst.
If you essentially are making the problem worse because
you're exacerbating it.
Yeah, you're exacerbating. That's the word I was looking for.
Yeah.
You're exacerbating the issue just by sitting down.
Yeah.
Right. Where most people are like, "Hey, I tweaked something. I'm going to stay at home and rest until I can go see Brandon because he's going to fix it all."
Yeah. I love when that's the case.
Yeah.
A lot of pressure.
And you have your hands full because you're like, that's not going to work.
Yeah.
You know what I mean?
Yeah. And then when we throw exercises in there, like, I don't know if I can do this. I was like, start light. Very simple body movement, core stability exercises. That doesn't take a lot. You can just breathe and do that.
So the best things you can do, if you're somebody who has that laborious job or somebody who is complete opposite, you're sitting all the time and you have the back pain that peeks its little head up one day, what's the best thing you can do? Move.
Yeah.
Okay.
Simple.
Tell me more. Move how?
So
why move?
Yeah. So it all comes down to reprogramming muscle groups to enable proper stability within pelvic structure and stability in the lumbar spine. What so many people don't know is that the low back muscles that people would call the back straps and the ones that create some of that definition in that lower back, all they do is hold you up. Yeah, that's it. They just help you to stay erected. That's why they're the lumbar erector spinae. They erect the spine. They keep it up. But stabilization that enables proper movement and function comes from intra-abdominal pressure. Comes from your core. Comes from this front region to help create what's called the empty can, essentially. And this is something I talk a lot with pregnant patients, alluding back to them, could be because the main reason is the pelvic floor is so important through pregnancy, prenatal, postpartum, and then also for recovery.
Amy's podcast is going to release tomorrow or Thursday.
All about it.
Yeah, we talked about it a lot.
Beautiful.
It was awesome.
And the thing is that even guys don't realize we also have a pelvic floor. It's not as
very quick that we have a pelvic floor and it needs properly trained.
Right. And that's
often.
And you sit there and you go, yeah, ours doesn't get as much abuse as what a pregnant woman would.
Right.
But it still needs help.
For sure.
Because we are more sedentary.
It was the catalyst to my healing of back pain.
Yeah.
My chronic back pain. It is 100% the sole reason why I am back pain free these days.
Yeah. And it's because you balance the pelvic floor as the lower portion of that empty can, the diaphragm just below the rib cage, enabling proper expansion of the lungs and helping with that visceral capacity in the chest. That's being the upper portion of that can. And then the front is the abdominal wall.
Yeah. So I got a perfect visual for you guys that are trying to visualize what we're talking about here. All right. Think of the fact that, yes, those two muscles along your spine, they are there to help you stay erect. But while you are in dynamic movement elsewhere, this pelvic floor, this intra-abdominal pressure, if you will, is meant to stabilize the spine itself. And it works just like it sounds. It's pressure activated. So if you think about, I don't want to say, get you a can of Coke. You know what? We'll stop on a can of Coke.
No. The replacement is, I was actually informed by James's wife, Jada, of Olipop. Okay. It is a prebiotic drink that is flavored. They have a vintage cola like Coke. So it's better for your gut.
Okay, so regardless, go get you a can of refreshment, whatever. Okay,
they should pay us for saying Olipop.
Yeah. That way, you have one, Coke can that is pressurized, not open. Okay, take the other one, crack it open, dump everything out. Okay, you still have two cans, right? One's full, one's not. Okay, go over and step on the one that's empty and see what happens to it. You crush it. Now go over and step on the one that's full. It can support your body weight.
You could do a pistol squat on it.
Yeah, well, yeah.
if you're balanced.
So that's how pressure works, and how it creates structure and stability. Okay, and a lot of us have no idea when they think about back pain. People's like, oh, you got to strengthen your abs or your core or whatnot. Okay, so I'll go do a bunch of sit-ups. Not the right abs.
No, not at all.
Where you and I collaborated for most people in their back pain and trying to establish a rehabilitation program was, and everybody has unique variables for sure, especially when you're talking about like previous trauma and previous compensatory measures that led to the issue that we're at now.
Yep, surgical changes and things
absolutely.
like that too. Yeah.
But 80% of the program itself was identifying a way to fix the lower cross syndrome and just adjusting posture. And whether or not you want to look at it as posture, that's what it is.
Oh, yeah.
You know what I mean?
It's functional stability as you're standing.
Yeah, you know,
Simple as that.
you're sitting here, you know, you're in your anterior pelvic tilt, okay? I mean, you, depending on how bad it is, you might have some kind of, you know, thoracic excessive, you know, lordosis, is that what it is?
Kyphosis.
Yep, okay,
kyphosis,
yeah, so you're rounding shoulders forward, chin forward, like all of that plays a role. Okay?
Oh, yeah.
And so when we went about going by the joint, you know, I kind of look at it joint by joint, trying to figure out which one is going to be the best way to start. And it always still starts around the lumbar spine and the lower cross syndrome with your hip flexors have to be more mobile. Like we need to loosen them up. Your posterior chain, your butt, your glute maximus, okay, needs to be stronger and more active. Your core muscles have to be stronger. And then your erector spinae needs to be relaxed.
Yep, engaged appropriately.
Absolutely.
Yeah.
So where, you know, everybody hates seeing it when they come in the gym on the board and they're like, gosh dang it, we're doing single leg glute bridges. Are you kidding me? Again? Why? And just so you can verify my position here, why is single leg glute bridges literally one of the best things you could possibly do for for back pain?
You get the appropriate posterior chain activation isolated to one side, but in order to maintain the proper positioning, you have to activate your core. You have to create that stability within the truncal region to do it, to maintain the appropriate activation to do the exercise appropriately. Like that's why the glute bridge is very simple. It's a very simple exercise.
Extend the hip.
Yeah, like, oh gosh, okay, cool.
Gee, I never thought of it that way.
The problem with some people though is they just do it by the motion and not by the activation.
Yes.
So like with every movement that is made, there is a intentional activation that should be done from specific muscle groups.
And a possible compensation that can come from it.
Yeah, exactly. If you do it wrong, like even just simply the glute bridge, for example, by having your feet flat on the ground, if you were to not apply most of the weight through the heels and you were to put more weight through the balls of your feet, you're actually activating more of your lower back musculature.
Well, and you're pulling a little bit more on the quads itself.
Exactly. So people will feel as they elevate in extension, they'll notice that they'll have quad tightness and low back pain, especially somebody that has active low back pain.
Yes, absolutely.
And then literally I'll sit somebody on the table, I'm like, have you been doing them like I showed you at the beginning, or in the case if we were collaborating with somebody,
right,
as Colton showed you? And they're like, well, I'm doing it like this. And I look at it, I'm like,
Yeah, so
I was like, let's take a step back.
Yes, and
pick your toes up.
For sure, yeah. And I love the idea of, you know, to help people visualize that, you know, because we're flat foot creatures, and you want balance and everything. But when we glute bridge, we want the weight towards the posterior part of your foot, and the reason being, if you were to stand upright, okay, and you were to keep your feet flat but start leaning forward, guess what happens? All of your anterior muscles on your body start to contract to prevent you from going forward. So guess what? When you have the weight shifted to the ball of your foot and you're trying to do a glute bridge, you're essentially putting resistance in the area that you don't want resistance.
Exactly.
You want that place to relax. You want the quads and the hip flexors to chill while you solely activate everything on the back. So on the other way around it, you stand flat-footed and you start leaning backwards, but keep your feet down. Guess what? All the muscles on your backside start to contract. That's what we want in the glute bridge.
Exactly.
So you keep your foot at the angle or at the position to make sure that all the weight bearing goes through the heel, and then it gets, you know, sent all the way through the posterior chain into the glute maximus itself. Now, a lot of, you know, people when they go initially, especially after an acute injury, like trying to do a glute bridge can be very hard.
It's true. Yeah, it's very true.
Depending on exactly what happened, but like I just take, you know, for example, you know, SI issues get thrown around. It's kind of, I think it's kind of the catch-all. You probably have a different opinion or not, but like,
yeah, you know, it is a catch-all for a lot.
But it's a lot of activation problem.
Oh yeah.
Right?
Yeah.
And so a lot of what you have to do and you have to work through is, okay, what range of motion I do have, I need to do establish activation in that range of motion. I have to. Okay, so that means you can only get your hip up a couple inches, fine, but squeeze your butt literally as hard as you can. You know what I mean?
Yeah.
And a lot of people, I find it fascinating, they can't squeeze their butt.
No, they can't. But then when they do, it fatigues out so quickly.
So, and that's why I like. This is why we do unilateral glute bridges. We do right side and then left side.
You find out the asymmetry.
Yes, we think that our bodies are symmetrical, but they're not. Excellent at compensation. But this brings up an excellent point, because this goes back into chiropractic care and adjustments. Because
totally.
I love when, you know, 80% of the time, I don't have any statistics to really, or I don't really have any literature to back up the statistic, but a lot of the time when people have lower cross issues, it can be mechanical in nature that we can fix, right? But you said something to me one time that blew my mind, that it made me really appreciate chiropractic care for what it is that you cannot fix a mechanical problem with a chemical solution.
So true.
So what do we mean by that? Okay, you have people with back pain that's like, I'm going to fix it with anti-inflammatory drugs or whatnot, but the fact of the matter is you could have a simple misalignment in your spine that's preventing your body from chemically talking and communicating with the muscle needed to put you in a good activation platform.
Yeah. I'm glad that I have educated you well on that too.
I swear,
That's the fun part.
I will learn from everybody something, but like that was one of the things. It's like, this makes so much sense because you can be sitting here beating your head against a brick wall trying to do these movements, but you're like, I still can't feel my glutes. I can't feel them at all. Well, guess what? Your body physically is having a hard time actually talking to them to say, hey, contract. You know
exactly. What I mean? In those situations, like I like to refer to foreign languages. All right. So say I'm speaking Portuguese and you're speaking, say, German.
I took German in college.
Yeah, there we go. You're speaking German. I'm speaking Portuguese. There's some things that will correlate because everything coming from a base Latin. There's some things that you might be able to decipher, but the communication still is not going to be as effective as if we were speaking the same language.
Right.
And ultimately, you have to look at it in that realm because the brain has to communicate with every single functioning, really everything that has cellular tissue within the body. And that includes bones, that includes all muscle tissue, that includes organ systems, that includes all actions that you consciously can perform, but even those that your body involuntarily does.
Right.
And that comes from the central nervous system of the brain. Like, people think chiropractic's for pain. It's all about neurology. It comes from the brain down and the spine out.
Yeah, that's a good point.
It's all a part of that. So say somebody's not activating their glutes well and they're not having that ability to activate the muscles. I know exactly where I need to look, and I'll do functional assessment testing with them to see whether or not their butt activates. And if it doesn't, I know where in the spine I need to look at to see if there's a joint motion restriction issue or inflammatory condition that's developing.
Right.
And if there's surgical change in that region, sorry about you. We are hitting max medical improvement to where we might only get so far. That's one thing that's always forgotten before people go under the knife, which in reality only works like 30% of the time.
Yeah.
That's an abysmal number, actually, by the way, too. If I was told that I had a 30% chance of success at doing something, I probably would seek other options.
It's kind of how I view people who get rotator cuff surgeries.
Yeah.
Because I get, I think the number is up to 7 right now as far as rotator cuff injuries in here that we have prevented surgery by doing
specific rehab,
specifically with the crossover symmetry bands, which bless those guys, that stuff is awesome, works wonders. But it's hilarious because we're going on a wormhole here. But people go get hey, you got a tear. Okay, what grade of tear is it? Well, I don't know. He didn't say.
Yeah.
What did he say? He says, I'm getting surgery in 3 weeks.
Here's a fun fact about rotator cuff tears. Usually it's the supraspinatus muscle, which
common
runs right up along the top portion of the shoulder blade, right above this bony ridge. Most common injured rotator cuff muscle. It's something around like 90% of the population will have a tear in that muscle at some point in time in their life. And most of them have no idea it's even there.
Right.
You can even have a full thickness tear and still not have an idea that it's there. You might have had pain at one point in time, but again, your body compensates to recover.
Right.
And there's 3 other muscles that incorporate the rotator cuff to help with rotation. 2 of them to help with the external, but
I think, and I can't remember, I'll have to look this up, but there was a study done on people with common supraspinatus rotator cuff injuries, right? Yeah. Specific to a grade that they would require surgery. And they started looking at some of the postural analysis that they're posture-wise. Yes, it's the rolled shoulders forward. Yep. It's the hunchback and the rolled shoulders forward. And then from there, it became, so then they started to identify tissue activation and tissue activation, and I think it was just simple range of motion stuff. And they found like the pec minor was overly active in the sense that really just because the shoulders are rolled forward, it's shortened and it's tightened, and the underactivation came from a lot of the main external rotators of the shoulder itself. Yep. So you got this forward rotation of the shoulder, and then anytime you try to do anything remotely overhead, it became inflamed.
Yep.
And then when you did anything horizontally, like pressing away from you, it just became unstable in the joint itself, or the shoulder joint itself. So I can't remember where I saw that study, but I'm sitting here thinking like, hey, I can fix your shoulder pain by making sure you have good posture and by making sure that you activate external rotators and relax your pecs, essentially.
Oh, exactly.
And it's like, I never would have thought about that. I just thought I did it lifting. No, you did it lifting because your posture is crap.
Yep, and you're overactivating anterior musculature.
For sure.
Again, we come back to the anterior musculature, just like with the lower cross issues.
Absolutely.
We as a human species, you think about it, we are bipedal. We walk on our feet. We are always moving forward. We don't walk backwards.
No.
Some people, they will take 1 step forward and 2 steps back, but that's due to their own doing, for that matter. But it comes down to like, we always, everything is forward, everything is in front. And think of like when I was talking about K through 12, you're sitting in school all the time. From the time we are 5 years old until the time we are, well, for some people who go on to secondary education, go to college or go to get a postgraduate degree, right there, you're looking at a good nearly 2 decades.
For sure.
Worth of time frame that you spend probably 75 to 80% of your living daytime sitting, rolled forward, and now with technology, everything being down too.
Down.
Used to be where you could sit and you could sit upright when you're in your chair because everything's on a blackboard or on a whiteboard.
Right.
Now it's, well, let's go log into our computers because the school's given us this wonderful technology. But how functional is it?
Functional, it's convenience.
Yes.
It is 100% convenience. Because, and I get it, we're trying to make the world a more streamlined thing. But the thing that is being taken the most advantage of right now is our health as humans. You know what I mean? Everything's on the phone. Like, I just went and bought a fancy new little watch, which... Isn't it kind of cool? You know what I mean? It is a smartwatch. Like I'm so anti smartwatches because half the people that get them don't know what to do with any of the information.
Oh no, they don't.
You know what I mean?
Yeah.
Nobody knows what to do with it.
That's why I don't have
and
one.
half of it's inaccurate anyways because they're going off of HVT and whatnot, and just trying to figure out your blood pressure by
based on some calculation that's done by that.
So I get it, and I'm equally to blame in some areas, but convenience is going to be the ruiner of health for everybody, and it really is. And when we talk about that in here, as far as like, hey, you want to eat better, quit getting things that are convenient because convenience will kill you.
Oh yeah,
you know what I mean.
Yeah.
And so yes, we're streamlined and everything as far as kids being sit in the desk. Another perfect example. I have kids right now that are in my lifting program right now. Made incredible leaps and bounds in their athletic endeavors just by lifting, as far as mobility and health and all this stuff. And then they got to go to school, and 2 days in school, and they've already developed pain from being in a specific small, confined chair. Seated positions. Yeah. You know what I mean? And, I'm 100% going to put all my eggs in the basket. That's the only thing that has changed that has elicited this type of response in this body. You know what I mean? Yeah. But you go back and forth into, okay, how is this convenience killing me? Yeah, the biggest thing that I noticed as far across the board, everybody's posture sucks. Nobody has good posture anymore.
It's true.
And I do my best. I had to be told this. Like, hey, Colton, your posture sucks. I'm like, oh, okay. How do I fix it? You know what I mean? Yeah. Now, if I'm coaching a class, like I walk around with my hands behind my back.
So that way you can actively...
It's literally, I'm pulling my shoulders back. I'm trying to look a little bit more proper. We have this little shoulder activation drill, conveniently named the ultimate shoulder activation, where you're laying on your belly and you're doing some scapular retraction and you're taking your rotator cuffs for a ride essentially, and you're activating a lot of your upper back and a lot of the external rotators of everything. But it's hilarious because whenever people lay on their back and they actively activate their upper back, I can tilt my head sideways and look at them on the floor and be like, that's your perfect posture. If you are standing upright, that's where you should be. That's how you should look. Yeah. And then when they stand up, it's right back to the rolled forward. You know what I mean?
The gravitational pull.
Holy crap,
everything,
dude.
Yeah.
Oh my gosh. So we have an uphill battle just with that. How do you have that conversation with somebody who comes in and like, I want to change my life, I want to do all this, I want to lift all the weights and this, and I'm like, hey, I need you to fix your posture. And they're like, Oh,
Yeah.
okay.
It's basically like you're like, okay, let's just slap these like training wheels on and completely put bumpers in your bowling alley, and we'll figure it out.
These are just things to be aware of.
Yeah.
Because you could be sitting here spending hundreds of dollars on, or thousands of dollars on physical therapy, or you'd be coming in twice a week with you, or way too frequently, and you could simply just be fixing your posture.
Yeah.
You could be fixing the way that you sleep. You could be fixing the way that you go about your daily life and managing your stress as far as pain management.
Yeah. And simply just the way people eat too.
Oh, yeah. Like, we're already at an hour. We can't go that far.
Oh, I know.
We will not stop talking.
Right. That's why we'll have more weeks. We'll discuss neurotoxins and other things
absolutely.
later.
So, you know, it's good to know these things, because nobody's going to be like, hey, how come my back hurts? And you're like, well, it's because the shoes that you wear are not meant for your feet. And they're like, I don't understand how that works.
They're like, but I have inserts.
But I have.
How dare that? How dare that create the issue? I have inserts.
Are you kidding me? Come on. No. So you have to look at identifying root causes when you get into pain management. You know, and the same goes for back pain. I can usually tell, just because I've experienced it, and because I've worked with many people now. I'm not a chiropractor, but I can usually be like, yeah, you have a rib out. You need to go see Brandon.
Oh, yeah.
It's pretty easy to tell.
Is it because of the wincing eyes and every breath they take? They're like,
take a deep breath and raise your arms over your head. They're like, I can't. They're like, yeah. And as simple as like, you know, hey, put your thumbs on your pelvis bones. You know, let me see from the outside, and you can see if somebody's like rotated by half an inch, and it's that's a problem. Or simply screening as far as, hey, can you do a glute bridge on the right side? Hold it for 30 seconds, and then you tell them to do it on the left side, and they start shaking after 3 seconds. You know, in that position, it's like, okay. So without getting so fixated on the actual issue itself, you have to start looking back and taking a much deeper look at why could this possibly have come? Because not all injuries are because of an acute one issue. It's really not.
It's a lot of the times it can be a compilation of very poor movement.
Yeah.
Bilateral and unilateral.
And we're not just talking about exercise. We're just talking about daily life movement.
Just walking.
Yeah, you walk in your high heels day in and day out.
Welcome to severe posterior chain tension.
Right. So,
and even more pelvic tilt.
Even more pelvic tilt is a big thing. So those are the things that you kind of have to look at, in my mind. I think you would agree with that.
Oh, yeah.
You know what I mean? We'll get into, when we have you back on here, I'm sure we'll do plenty of podcasts, but pain management is the biggest thing. I'm in pain. How do I get out of it? Okay. Well, the thing is, and James and I talked about this 2 podcasts ago, as far as, do you want to heal pain or do you want to fix the issue?
Yes.
And that's the biggest thing. Yep. If you want to go feel good for a little bit, hey,
pop some pills.
Go pop that.
That's what they do.
Get your cortisone shot and do whatever you want. But if you want to fix the issue, you have to take a much more laser vision approach, as to looking back and really critically identifying what could possibly be the cause.
Yep.
You know what I mean?
Yep.
I find myself asking more questions than I do actually suggesting information anymore.
Oh, yeah.
And it's just because it's these all can play factors into it. And they're like, oh, I had no idea. And it's like, hey, fix this one thing. And they're like, I feel like a new person.
Yeah, it's now fix all these other things too.
Yeah, fix all these other things.
It comes down to if somebody wants to get better, first step, get out of their own way. We all have to. I can't tell you, the one thing I love, patients that I've been seeing since day one when I moved back from St. Louis after school, and I still continue to see them. I don't see them but maybe once every 1-2 months because they're doing well.
Maintenance.
They do self-checks.
Right.
They have such great self-body awareness. They know what's wrong with them when they come in. And as much as, like I said, I don't like somebody diagnosing themselves and coming in and telling me what's wrong with them. But when it's individuals like that who I've been seeing forever and they're educated on what's going on, I'm okay with it. When they come in and say, hey, I know, they're like, I know C1's off. I was like, you've been stressed lately? Yeah. And they're like, oh yeah. It's like, okay, well, let's take a look into it and see.
Yeah.
And we check. If there is a problem, we fix it. If there's not, you leave it be. But they at least acknowledge that something they've been doing is creating the issue.
Yeah. You gotta eventually get sick and tired of your own BS.
Yeah.
And when you do, you can really start to transform your body, your mind, and just your ability to self-heal. Not self-diagnose, but you can start to really be consciously aware of what your body is doing. Yeah. Listening to what your body says.
Yeah. And learn to adapt, even if it isn't 100% even too. Everyone wants to be perfect to 100%. Well, sometimes achievable levels may only be 90%. But if you can get to that, and that's the max improvement that can be made for your physiology because of other pre-existing issues, go for it.
It's better than
sitting it's better than sitting on your couch with low back pain for 7 months waiting for it to get better.
It's good. It's better than waiting for anything to heal on its own and just sitting here waiting for it to be better.
Right.
If there's any takeaway, if you have, any kind of injury, whatever that is, don't wait on it to fix itself.
Yeah.
Be
proactive.
Start implementing your healing process. And obviously, if you need help with that, go look up Dr. Brandon Wallpe, because he can help you out. That's fun. We've gone quite a long ways. So we'll wrap this one up.
Yep.
Anything you want to add to this?
Thanks for letting me come on. I mean, I love it. Posting up. It's nice coming in here now. I used to be in this room 4 days a week, and now I'm only in here on Thursdays.
That's all right.
I miss the drive to Greensburg sometimes. Actually, a lot of the times. It's nice. It's nice to have the seclusion, and just to be one-on-one to work with people. But yeah, I love coming on, man. Appreciate it.
We'll do it again, guys. Thanks for tuning in, listening to this one. This is a Silver Bullet podcast.